the respected chair and co-chair of the session, and the august audience. I am grateful to the organizers of the conference for giving me the opportunity to present our concern on the elimination of lymphatic filariasis in India. Myself, Dr. Madan Mohan Pradhan from Odisha state of India, and the co-author Dr. P.K. Srivastav, the former ELF Nodal Officer of the India's National Vector 1 Disease Control Program, present before you on lymphatic filariasis elimination and the concern for introducing vector control in India. Lymphatic filariasis is one of the world's leading causes of long-term disability. Though the disease is not fatal, it significantly impairs quality of life, leading to severe physical disability and imposing substantial social and economic burden on the affected individuals, their families, and entire communities. The disease has a longer incubation period. It manifests with acute febrile episodes, inflammatory swelling, followed by chronically disabling elephantiasis, lymphedema, and hydrocele. Now, worldwide, 83 countries are lymphatic filariasis endemic, and more than 1.2 billion people are at risk, and 120 million people have already been infected with the disease. Since 1998, the global program to eliminate lymphatic filariasis has targeted elimination of lymphatic filariasis by 2020, but this could not be achieved. In its first 8 operational years, the program has scaled up to provide more than 1.9 billion treatment through annual single-dose mass drug administration in short MDA to 570 million individuals living in 48 lymphatic filariasis endemic countries. Conservative estimation shows that the global program for elimination of lymphatic filariasis has had an unprecedented public health impact on both lymphatic filariasis and other neglected tropical diseases, and its efforts are highly applauded in achieving the global health target. To eliminate the disease, we have to understand the life cycle of the lymphatic filariasis parasite. Here we have given the picture of the life cycle of Wucheria bankrupti. There are two hosts for the parasite. One is the mosquito, the other is human being. In mosquito, the parasite larvae develops through three stages. One is larvae 1, larvae 2, and larvae 3 stage. The larvae 3 stage is transmitted to the human body while the mosquito bites to shock the blood meal. And inside the human body, the parasite develops into adults in lymphatics, and then these adults produce the cysts and microfilari that migrate to lymph and blood circulation, and the adult microfilari, they uh, occlude the lymphatic channels, and thus they cause the inflammation and then manifestation of the disease. And the chronic disability occurs due to as they affect the different organs. The causative agents in India, Wucheria bankrupti transmitted by the vector Culex cunici fasciatus, and the Brugia malai infection is transmitted by Mansonia annulifera. These are the two main parasites in India. Adult one, they live in the lymphatic vessels and disrupt the normal function of the lymphatic system. Mosquito sucks microfilary with blood meal while sucking the blood, and the microfilary penetrate gut wall of the mosquito and develop in thoracic muscles. The first stage of the larvae, that is L1, takes place in 2 to 3 days, and the second stage completion occurs in 5 to 7 days. Third stage development completion occurs in 3 to 5 days. Thus, total 10 to 15 days is needed for the third stage development of the microfilary, and the third stage larvae are deposited in the skin while the infective mosquito bite the human being for its blood. Larvae makes entry in the human body and reach the lymphatic channels. It settles down at inguinal, scrotal, or abdominal lymphatics and begin to grow into adult form. After fertilization, the female worm gives birth to microfilary. Microfilary circulate in the peripheral blood only at night. This phenomena is called nocturnal periodicity. The nocturnal periodicity is presumed to be associated with the feeding habit of the vector mosquito. The main points of the life cycle of the parasite is it requires many infective bites to become the microfilary carrier. The microfilary carriers are asymptomatic for 5 to 6 years. The chronic disease cases are mostly negative for micropyremia. The microphylloremia exhibit nocturnal periodicity in the mainland of India. The incubation period, the interval, is nearly 1 year. For the elimination of lymphatic filariasis, mainly two strategies have been adopted. One is interruption of the transmission of the lymphatic filariasis by annual mass drug administration with DEC plus albendazole. This is done for 5 to 7 years or more to the entire population except the children below 2 years, pregnant women, seriously ill persons. Ivermectin has been added to these two drugs. Now, in the program, three drugs have been introduced, and these have been done in selected districts and also is being upscaled. The second strategy is morbidity management, and it has two components. One is home-based lymphedema management, and the second is upscaling of hydrocele operation in the identified community health centers, district hospitals, and medical colleges. The World Health Assembly in 1997 resolved to eliminate lymphatic filariasis globally as public health problem. India is one of the signatory to this World Health Assembly resolution. WHO aimed to eliminate lymphatic filariasis by 2020, but aligned with the Sustainable Development Goal by 2030. In 2004, MDA in India was launched with one drug, that is diethylcarbamazine DEC, and in 2007 albendazole was added to DEC, and thus the two drugs are used and upscaled in the program. In 2019 and 20, the third drug ivermectin was added, and now the IDA, the third drug, has been introduced in the program and is being upscaled. The geographical area for MDA increased from 202 districts to 345 districts, and the at-risk population for lymphatic filariasis has been reduced to about half. This is a tremendous achievement. The accelerated plan with five-pronged strategy approach has been initiated in 2019. And in response to Sustainable Development Goal, India is undertaking an extensive measure to combat and control the disease by running the massive mass drug administration campaign in the country. And MDA districts to 56 and in 16 states plus 5 union territories. And the map, which was red earlier, has now become green most of the time because the tasks, many districts have passed tasks. And the current framework for global program for ELF, this is the vector control has been added in the MDA and in post MDA, the genome monitoring and the vector control for preventing recurrence of the new infection. And monitoring and evaluation has given a lot of emphasis, and MMDP as the situation analysis, making plan, minimum package for MMDP care, and then disease development, verification, MMDP, and integration of the rehabilitation cases in the healthcare system. After so many efforts, there are many challenges which we have to face. The main challenges are post MDA efforts to sustain the gains after MDA. The lymphatic filariasis entomology needs to be given priority. The lymphatic filariasis vector control in post MDA is to be ensured in all implementational units. Vector control for malaria must widen the scope for lymphatic filariasis transmission by Culex, Mansonia, Aedes. Effective MDA is to be ensured to interrupt the transmission. Functionality of MMDP clinic in each implementational unit, which are now at the block level, are to be ensured. All clinicians are to be trained to segregate lymphatic filariasis lymphedema. Surgeons are to be involved actively, especially in endemic areas. How to achieve the elimination of lymphatic filariasis goal in India? The roadmap for 2024-25 is the last round, the effective MDA round, and for 2025, 26, and 28, there should be completion of all three tasks: functional MMDP clinic in all implementational units, vector control to be ensured, and verification is to be made. And in 2029 to 2030, there should be the development and submission of dossier and elimination status to be achieved in India, which is the SDG goal aligned to 2030. Thanks for attention. Thank you again.